Hi, my name is Laura. Welcome to my PDSA Quality Management Project. I worked with Competent Care Home Health Agency Administrator in developing a CEMS Emergency Preparedness Plan update. So the issue identification is that in the event of a disaster, Competent Care Home Health Administrator will initiate the company disaster plan according to CMS regulations. And the purpose of the emergency plan, of course, is to establish a plan that will allow for continuation of services in the event of a disaster, whether natural or man-made. And the quality variance will be determined once the plan is evaluated and analyzed following the emergency plan testing. The CMS requirements for the home health emergency plan includes 4 core elements. And those are risk assessment and emergency planning. So we'll talk about that. We'll talk about policies and procedures in line with the plan, and then communication plans and training and testing. So the root cause analysis is that an unplanned natural or man-made event that disrupts the environment significantly, such as damage to buildings or severe storm, flooding, earthquakes. Accidents or emergencies within the organization. So we have a planning process that starts with before the emergency, which to identify potential emergencies, we came up with a conduct hazard vulnerability analysis. And then we developed an incident command center. We defined roles within the organization, starting with a communication plan. We organized procedures that describe mitigation, preparedness, response, and recovery strategies. And then we came up with key leadership to activate and implement emergency plan, and then discontinue or terminate when appropriate. So here is the hazard vulnerability analysis that talks about the scope of the problem. We came up with the events that are most likely to become an issue in South Orange County, including wildfires, flooding, earthquakes, power outages, disease outbreaks, terrorist attacks, explosions. And because emergencies and disasters are unpredictable with variable results, that can present a breakdown in the ability to provide patients with care. We have this emergency planning. So policies and procedures, we know that implementing a solution starts with a communication plan. And so our communication plan includes the need to review and revise annually, and then it will include contacting staff, patients, and physicians. There's a method to share medical documentation, and then we have a way to release resident information during an evacuation. We need to have a way to communicate the situation with local authorities and incident commander, and then a way to share the information about the plan with the patients and caregivers. So we determined that the office will keep and maintain a current hard copy of the contact information for staff, family members, vendors, emergency service and hospitals, and other appropriate community resources. Another part of our solution implementation is that we have our main players, staff contact information. We said that the administrator on duty will serve as the incident commander, and he will have the authority to activate and deactivate the emergency preparedness plan based on the information provided. We have made our command structure with roles and responsibilities. So we said that our chain of command will be the RN administrator, who will notify the staff coordinator, and the staff coordinator will notify nurses, and nurses patients, and so on. And then we decided that the command center for Competent Care Home Health would be the Costa Mesa Library. And then part of the policies and procedures was to come up with a priority classification for patients, and that includes high priority patients being level 1, and then the lowest priority patients being level 4. So high priority means that those patients must have care. So those patients are usually unstable and could deteriorate or need hospitalization if the patient is not seen. So in case of a disaster or emergency, every possible effort must be made to see those patients. And then patient emergency service for patients, we came up with emergency guidelines for disaster preparedness according to CMS guidelines. And then we also have emergency service contact information for patients. And some of the basic guidelines for patients to prepare for an emergency are listed here. And so we've come up with a comprehensive plan for meeting the health, safety, and security needs of the agency staff, patients, and community prior to, during, and after an emergency. So we've informed patients that even with all of our planning, it's possible that patients and families might be on their own for a period of time before anyone can contact them or get to them. So we've given them these guidelines so that they might be able to reach their friends or loved ones or emergency services during that time between the time we're able to get to them and any treatment that they might need. So we included here some flood preparedness and response and the warning systems that are available, and we've gone over an evacuation plan to help them avoid confusion and prevent injuries, and we've encouraged them to have a thorough evacuation plan and what that plan should include. So we talk about what to do before a flood, during a flood, and after a flood, and then we do the same for fire evacuation, and we go over fire safety, the fact that they should have smoke alarms and fire extinguishers and a fire escape plan in place that should be reviewed, and what to do if their clothes catch on fire, and then we go over steps to take after a fire. And then, of course, in case of an earthquake, some preparations, drop, cover, and hold, protecting your head with a pillow, and then we provide resources for updates on weather and road conditions. And then important to note, we have mitigation activities according to policies and procedures that include healthcare records, the administrators to have a backup at their residence. Individualized care plans will include assessments, and then patients and families are to be educated on emergency preparedness, as we talked about. Patients, of course, have their desired categories so that we know how to triage patients when the emergency plan is implemented. And then the agency maintains a hard copy of a patient list with contact information and categories in the event of power failure. Communication plan, preparedness activities. We go over that. The plan complies with federal, state, and local laws and is reviewed annually. And then important, the plan isn't any good without training and testing. So this is really important. The initial training to new hire and existing staff will take place, and then education will be provided annually. The training needs to be documented in patients' personnel records, and then emergency management plan will be tested annually. And then when an emergency is declared, the administrator will initiate the pyramid phone communication plan. We said that safety of all patients and organization personnel will take priority. Administrator will maintain communication and act as the spokesperson among other facilities, the media, and the community. And nurses will review assigned category classifications for all patients. And the agency will notify the caregivers to obtain needed medications and supplies immediately. And then Category 1 patients will be cared for first, and Category 2 second. And then The study analysis for the management plan, so the evaluation results and proposed improvements of an actual emergency or exercise will be presented to the staff and individuals under agreement, volunteers as applicable, and the governing body. The evaluation may also be added to the organization's quality assurance performance improvement plan. So, and then after the emergency, we want to act as part of the PDSA, what are our next steps, what measures are needed to meet the goals of solution. So Competent Care is going to modify the emergency management plan in response to the critiques of the emergency event response and will prioritize processes identified for improvement, develop and institute plans for improvement. Thank you for listening to my presentation, and here's a list of my references.